Good evening, ladies and gentlemen. My name is Jagdeep Alwalia. I am the founding secretary of the Indo-American Chamber of Commerce of Greater Houston, which I currently serve as executive director. We are a 21-year-old nonprofit, and the next generation is one of our most important initiatives. It is a special initiative focused on the needs and interests of the next generation. And we are proud to have Anish Nagar and Dilbag Singh, who lead the Next Generation initiative of the Indo-American Chamber of Commerce, which was started by Narayan Bhargav a couple of years ago. And we are proud of the great work that this group has continued to do on behalf of the Chamber. Chamber has multiple facets in its activity. We have the Women Mean Business series, which is supported by Shell. We have the Distinguished Lecture series. We have international trade initiatives and a multitude of other events. I invite all our attendees to log on to iaccgh.com to understand what the Chamber is all about. I repeat, iaccgh.com. I also want to, at this point, introduce my board and executive team, our directors at large, and our advisors. Our current board is led by Tarush Anand, who unfortunately could not join us today because of a prior commitment, but he sends you his greetings. I want to acknowledge Dilbag and Anish, who helped organize today's event. I want to acknowledge Seva International, the Indian Doctors Association, and IMAG, the Indian Muslims of Greater Houston, not only for spreading the word about today's webinar, but also live streaming the event on their individual portals. I want to acknowledge Bhavna Kalyan, who is our tech guru at the Chamber. She actually runs the Chamber, and most of our events are thanks to her hard work. So I want to give a shout out to Bhavna. At this point of time, it's my honor and privilege to welcome the president of the Indian Doctors Association, Dr. Jignesh Shah, who is one of our partners with whom we have done a series of events. He is a partner of the Gastroenterology Consultants, PA, the largest private practice GI group of Greater Houston. He completed his training in pediatrics, internal medicine, gastroenterology, hepatology, and nutrition at the University of Louisville. He serves as a clinical assistant professor at Baylor College of Medicine. A few of his past appointments: chairman of the Department of Internal Medicine, section chief of Division of Gastroenterology, chief of staff and member of the executive board of Harris County Medical Society. Dr. Shah has received numerous accolades, including Physician of the Year and Rising Stars in Texas. Today's speaker was thanks to the efforts of Dr. Shah, and we are requesting Dr. Shah to introduce Dr. Shama Rashid, who will be making the presentation. After Dr. Shah has introduced her, I'll come back and introduce or welcome Dilbag Singh from the Next Generation, who will be kicking off the rest of the event. Dr. Jignesh Shah, the president of the Indian Doctors Association.
Thank you, Jagdeep. Just wanted to take a few minutes and talk about Indian Doctors Association prior to me introducing Dr. Rashid. We are a group of...
Can you speak a little louder?
We are a group of... Can you hear me better, Jagdeep?
A little louder, please.
One second. Sorry about that. Let me change my mic settings. Is this better?
Yes.
So, just to recap again, I wanted to take a few minutes to talk about Indian Doctors Association before I introduce Dr. Rashid. Indian Doctors Association, a group of physicians of Indian origin from Greater Houston. We are a nonprofit organization incorporated in 1983. Our new core adoptive vision is based on connecting, inspiring, and community. Our events are centered around networking, educational programs, business seminars, community outreach, mentoring our youth, volunteering opportunities for nonprofit clinics, mission trips abroad, scholarships for high school bound college students, and medical students. In 2019, we held 16 events and 5 events prior to COVID focused on these aspects. Since March, we changed our direction on giving back to the community by providing expert physician specialty awareness videos on social media, telehealth support to those in need, and personal protective equipment and meals for affected families. Within the last 6 months, we gifted 2 endowment scholarships, one to the University of Houston School of Medicine, the brand new med school in Houston, and the second one at University of Texas Medical Branch. The scholarship will be awarded every year to first and second year medical students indefinitely, since they're endowed scholarships. Our hope is that it will foster the growth of caring and compassionate physicians in the greater Houston community, who will eventually become our future leaders in greater Houston. Second part of this webinar is to introduce a colleague and a friend. Dr. Shama Rashid is a double board certified child, adolescent, adult psychiatrist with over 20 years of experience taking care of patients of all walks of life, including wellness and mental health. She is a proud University of Houston alumni and a graduate of UT McGovern Medical School, where she completed her residency in adult psychiatry with postdoctoral fellowship in child and adolescent psychiatry in 2014. She has served as assistant professor at Baylor College of Medicine and former medical director of child and adolescent division at Kingswood Pines Hospital, Kema Palms Recovery, and New Horizons Hospital. Dr. Rashid currently serves as the Chief Medical Officer of New Horizon Hospital. Dr. Rashid definitely brings a wealth of knowledge and expertise to her private practice and clinical research. She continues to offer cutting-edge technology and medical treatments for her patients. Her patient approach has led to a loyal following of patients and thriving clinical practice for mental health and wellness. I've had the opportunity to work with Dr. Rashid, and there would be no one better to speak on this topic of anxiety and mental health. Once again, Dr. Rashid, thank you for making time in your busy schedule tonight to speak on this problem we are facing as a community.
Thank you, Dr. Shah. Really appreciate your support. And we are looking forward to listening to Dr. Rashid. With this, I hand over the program to Dilbagh Singh, one of the co-chairs of the NextGen by ISCCGH, a program the Chamber is very proud of. He is a member of the Chamber with Anish Nagar, his co-conspirator in the Next Generation Initiative. Anish will be joining us in a little while, if he already hasn't joined us. With that, Dilbagh, I would like you to introduce yourself. Talk a little about your new business venture for a couple of minutes. They have started a new venture, and some of you doctors, if you're looking for good investment opportunities, this would be a good business opportunity, Dr. Rashid, for you to invest in, because this is a brilliant group of people. And rather than write a big check to the Chamber, you can write a bigger check to them and help them grow their business. With that, I want to hand over to Dilbagh Singh, our moderator and our co-chair of the NextGen. Dilbagh, on to you. I will go mute and I will switch my camera off.
Thank you, Jagdeepji, for the great intro. Hi, everyone. My name is Dilbagh Singh. I'm, as Jagdeepji mentioned, I'm a board member of NextGen Exchange, which is a young professional arm of the Indo-American Chamber of Commerce. And our goal is to provide students, young professionals, and entrepreneurs with access to everything the Chamber has to offer, all the resources they have to offer. And without a further ado, I'm just going to kind of kick this event off. Dr. Shah, we can chat a little bit later about what it is that I'm doing on the side. Dr. Rashid, if you'd like to kick off the event.
Good evening, everyone. Thank you so much for taking out the time on this Monday evening to join me to learn about mental health and anxiety in relation to our pandemic that we're dealing with in the world today. So first of all, thank you so much for the introduction, Dr. Shah, and thank you so much for everyone tonight participating. And I hope that y'all will enjoy what I have to say today, learn a little bit, and also ask any questions that you may have. So just a little bit about myself. I am a proud native Houstonian. You know, I went to university here, went to medical school here and residency, but I did have the chance to live in Dubai and actually did media psychiatry there. So this kind of televideo, Zoom conferences and things like that in telepsychiatry is something that's been ongoing for a long, long time. Now with the advent of, you know, what's happened this year with the COVID-19 pandemic, all of a sudden telemedicine and telepsychiatry has just exploded. I have been fortunate enough since I moved back from Dubai in 2010 to run my practice, my Dubai practice from Houston. So when the COVID-19 pandemic, you know, came upon us, I think that a lot of people in our community came to me to learn more about how to manage not only the psychiatric symptoms that they were seeing in their practices, but also just how to do telepsychiatry. So I'm going to talk a little bit about that towards the end, but let's talk about anxiety and mental health and wellness in general. I have a very holistic approach to treatment. It consists of your physical health, your emotional health, your spiritual health, and your intellectual health. And I think it's fair to say that all of us have been affected in all four areas since this pandemic started. I think that for patients that suffer with mental illness, though, it's especially challenging because a regular day for them is already tough. You know, just getting through life and functioning with dealing with their medications, their anxieties, their depression, their anger, their mood swings, their insomnia is already tough. But definitely the pandemic has added a very unique set of stresses upon all of us. So what's happening now is that patients who are kind of on the fence or their symptoms were there, but they weren't significant enough to warrant treatment, are now coming out of the woodworks. And we are just overwhelmed in mental health right now, trying to take care of individuals like you and me who probably may not have needed a mental health professional, but now may be seeking that. And there are three main reasons for that. Number one, you know, there's all of these new social distancing restrictions, which really add to the fears for patients who suffer from depression or anxiety or any sort of anxiety disorder. Fears of contamination have definitely added a lot of stress to our day-to-day normal lives already. The second big thing is separation from families. I don't know if y'all are dealing with that, but you know, I have a set of elderly parents that live in town, and definitely not being able to see my father, for example, yesterday on Father's Day, because he has, you know, he's 79 and he has Parkinson's, and we don't want to risk, you know, hurting him. And so I think that's added to a lot of stress, not just for the youth, but for the elderly as well, because we're not able to have those connections and that support system, which we relied on so heavily from our family and friends that we saw in person. Remember, human beings are social individuals in general. And so taking that away has been a huge coping skill, right? The third thing is that's really added to all of the stress is the deteriorating economy. I mean, unemployment is an all-time high. A lot of people are losing health insurance. They're not able to make ends meet. Even with the stimulus checks coming in and things like that, people are having a hard time. So the fear, so if you're dealing with anxiety, which is the first topic I'm going to talk about, you know, the fears of contamination, the social family issues, and the financial worries have really led to, I would almost say, an epidemic and a mental health crisis facing us today, not just in the United States, but around the world. Now, how do we address this incredible need? First of all, the statistics are pretty concerning. On a good day, before the pandemic, only 50% of counties in the United States even have a psychiatrist. And I'm also a child and adolescent psychiatrist, so I take care of children and teenagers. And only 30% of counties in the United States even have a specialist like myself. So the majority of mental health issues are taken care of by primary care physicians. About 59% of cases of anxiety, for example, or even mental health in general, are taken care of by primary care physicians. So you've only got about 41% that are coming to see the psychiatrist in the first place to seek treatment. And out of that 41% that gets care, I would say only half of them really actually see a specialist. So even though they get diagnosed with a mental health condition, and you know, about half of them still don't even seek treatment. So I would say about 59% don't get any care at all that need it. And out of the 41% that do get care, you've only got less than half of those seeing a psychiatrist. What does that mean? That means that the primary care physicians are really dealing with the bulk of the issue. So fortunate individuals that are able to see a specialist like myself can really get specialized care, but I can definitely see that the condition has really hit such proportions that our entire medical community has been severely affected. In fact, the World Health Organization has said that depression is the number one medical diagnosis in the whole world. It is the number one diagnosis in medicine that causes economic distress in the United States is depression. And depression is soaring right now. Anxiety is soaring. 1 out of every 2 individuals in the United States at some point in their life will suffer from anxiety. And so there's pretty much 100% chance that somebody that you know has been through or is undergoing currently severe anxiety disorders or some sort of depression or other mental health illness. So before we talk about the different types of issues that affect mental health, I'm first going to divide it up into anxiety disorders. So there's 6 different types of anxiety. The first and most common is generalized anxiety disorder. And generalized anxiety disorder is when for at least a period of 6 months, you actually have certain symptoms. And those symptoms can include, but they don't have to include all of them, but we should have at least 6 of these. Problems with sleep, physical aches and pains. Dr. Shah can attest to this. You have a lot of patients with like stomach upset, diarrhea, irritable bowel syndrome, gastritis, things like that. People have back pain. You have episodes where you sweat easily. You can have, like I said, headaches. You can feel very restless. You worry about a lot of little things, and you have a hard time controlling that worry. You tell yourself, I'm not going to worry, but you still worry. You worry about not just one thing, but you worry about multiple different things. It just makes it difficult for you to even relax. It can cause irritability, it can cause mood swings, and it can really affect your social and occupational function. It causes actual distress. And it's not due to any other drug side effects. It's not used to drug use or alcohol use. It's not due to any of those. So if you suffer from these symptoms for about 6 months, that means that you have a diagnosis of generalized anxiety disorder. Now, like I said, add to that the fear of contamination, social distancing restrictions, the financial issues, the social issues. Another aspect that's added a lot to anxiety in my practice specifically is that families are now all together in one house and they're home all the time. So those avenues that we had to go work out at the gym or go to work or go to school, do things to kind of create sometimes some healthy distance with our family members is no longer there. So we are stuck with all it. So we've had increased incidents of domestic abuse and violence. We had a 15% increase in suicide rates, since the first month. So there are a lot of things that are coming out in terms of unhealthy family dynamics or things that people weren't used to that are now all of a sudden stressing us out. I mean, I get patients coming all the time. My husband's stressing out. My wife is stressing me out. My kids are stressing me out. They're here all the time. I'm not used to taking care of them all the time because they go to school and now I'm stuck at home. I might lose my job. So there's a lot of reasons why patients are suffering from generalized anxiety disorder more than ever. But there's 6 different types of anxiety disorders, and I think it's important for y'all to learn those 6 so you know kind of which one you're dealing with. And the second most common one is called panic disorder. And panic disorder, you guys, this is a very, very important diagnosis to know because this is the number 1 reason for emergency room visits for chest pain. So the majority of emergency room visits where people think they're having a heart attack or they're ruling out a heart attack, the majority of those, majority reason is not the heart attack, it's a panic attack. And it can mimic a heart attack. And that's why it's so important for you to understand what a panic attack is and what panic disorder is. So panic attacks, the hallmark sign of panic attacks is they don't have a trigger. So most people think that panic attacks happen when you're in the middle of an argument, when you're stressed out. No, you could be watching TV, you could be sleeping at night, chilling out, and all of a sudden you can wake up. You could be having a conversation with your friends. You could be having a meal and boom, it just hits you. 0 triggers needed. Now, obviously, if there are triggers, they can still happen. But a lot of people just say, I live in fear because I never know when I'm going to have one. So what do panic attacks consist of? So there are 13 hallmark symptoms, and you need to have about 4 of them. So they consist of shortness of breath, tightness in your chest, feeling like I can't breathe. You can have heart palpitations, sweating, an increased heart rate. Sometimes you can tremble. You can have feelings that you're choking. You can have nausea, abdominal distress. You can feel dizzy, lightheaded. You can feel hot or cold chills, numbness or tingling. You can have a sense of what's called derealization, which is like feeling like you are, in an unreal state, or that you're detached from yourself, which is called depersonalization. You can have a fear of losing control or going crazy, a fear of dying, a fear of sense of impending doom. And it usually lasts, and this is also important to know, this is not something that lasts all day long. It lasts for a few minutes. Some people say it lasts for an hour, even 45 minutes, but generally speaking, panic attacks last for about 5 or 10 minutes, and they leave the person feeling exhausted. And these can happen once a month, once a week, every day. It depends. But what happens is it becomes very debilitating because you never know when you're going to have one. So you start fearing doing things or avoiding things, thinking, if I do this, maybe I'll have one. If I do that, it makes you withdraw socially because you never know when you're going to have one in a social setting or outside. And it can be embarrassing when you're having one. So panic attacks is another type of anxiety. So far there's 6 types of anxiety disorders. The first one is generalized anxiety disorder. The second one is panic disorder. The third is social anxiety, which is basically the symptoms that I'm describing in anxiety, but they happen only in social settings, which can also be very, very distressing for people. Now, obviously with the pandemic, we're not getting to be as social as we normally are. So maybe for some of my patients with social anxiety, they're like, this is great. I can work from home. I don't have to go anywhere. And I can do my work, and my social anxiety is so much better. So that's the one kind of anxiety I think that's gotten a little bit better over this pandemic time. The next type is called a specific phobia. And specific phobia is just fears of roaches, fears of spiders, fears of heights. Those are phobias. The next kind is obsessive compulsive disorder, which is extremely debilitating for patients. It starts off with thinking. When you ruminate about things over and over and over and over and over, and it gets stuck in your mind and you just can't get it out, those are the obsessions. So those could be fears of like hand washing, getting dirty, leaving the lights on, feeling unsafe. It could be repetitive thoughts, negative thoughts about a past relationship or things that have happened to you that just bother you over and over and over. Those are obsessions. But OCD specifically is when you have an obsession and then you need to do something to undo it. So there's a difference in just having an obsession versus OCD. So OCD is just the obsessions are just the ruminative thoughts, but compulsions is when you feel like you actually have to do something to undo those negative thoughts. Okay, those bothersome thoughts. So my hands are dirty. I need to go wash them. I need to, check the doorknob 3 times this way. I need to turn the light switch off a couple of, 4 times in this pattern. I need to walk and not walk on cracks, things like that. That's OCD. It's also, OCD is a form of an anxiety disorder. And the last one is post-traumatic stress disorder. Now, post-traumatic stress disorder is when you have symptoms of hypervigilance where you're looking over your shoulder, you're having bad dreams, you're having nightmares, all in response to trauma. So if you have a life and death situation where you felt like your life was in danger, or you felt like something very traumatic happened to you, you can have trauma from that, and that can lead to symptoms that mimic anxiety and depression, but it's a very specific set of symptoms that involves direct relation to a trauma event, leading to things like I said, nightmares, poor sleep, anxiety, depressed mood, looking over your shoulder, sights and things that smells that remind you of that trauma. You relive that event over and over. So that's the last kind. So let's go over the 6 kinds of anxiety. We've got generalized anxiety disorder, social anxiety, panic disorder, specific phobias, obsessive compulsive disorder, and post-traumatic stress disorder. All right. So now that you know the different types of anxiety, and remember, anxiety is the #1 most common diagnosis in psychiatry. So 1 out of every 2 adults will suffer from anxiety at some point in their life. It is the bread and butter of psychiatry. So, and remember that anxiety also overlaps with a lot of other things. There's a very high comorbidity, meaning that patients with anxiety can oftentimes have other diagnoses associated with it. There's a very, very high rate of depression associated with patients with anxiety. Did you know that 79% of patients with anxiety at some point in their life suffer from depression? And 75% of patients with depression meet criteria for anxiety. So I always tell people it's a spectrum in terms of treatment. And when we get to treatment, we'll talk more about that. Patients that suffer from depression and anxiety as a combination, it's harder to treat them. They have to stay on treatment for a longer period of time, and it follows a more chronic course. So patients that have both are more likely to have it again, or repetitive episodes. Anxiety is also it's a very serious issue, because about 25% of patients with anxiety suffer from thoughts of not wanting to be alive. They just wish they were dead. About 13% of them think about suicide a lot, just because it's so hard to get through the day. And then almost 20% of them try to commit suicide at least one time in their life. So it is actually a very serious diagnosis, like I said, especially because a lot of times it overlaps with depression. And to understand what depression is, it's important as well. You need to have at least a 2-week period where you exhibit 6 of 9 symptoms. And those symptoms can be feelings of sadness, an over sense of guilt, not being able to enjoy things the way that you used to enjoy them, problems with memory or concentration, feelings of not wanting to be around others socially, like just wanting to be alone all the time, having trouble falling asleep or staying asleep, feeling like you're constantly tense and restless all the time. Of course, thoughts of suicide, thoughts of not wanting to be here, feeling that everything's your fault, feeling tired all the time, sleeping and waking up and just not having any energy. And those symptoms, you have to have about 6 out of 9 of those symptoms for a period of at least 2 weeks consistently to be diagnosed with an official diagnosis of major depressive disorder, okay? And that, like I said, is also increasingly common now during the pandemic because of the extra stressors. But let's talk about hope. Let's talk about treatment. So the good news is that anxiety disorders are very easily treated. I mean, we probably have about a treatment success rate for people who actually do it properly, about 98%. So it's really, really good news if you're suffering with generalized anxiety disorder or even panic disorder. And there's multiple ways and modalities of doing it. Now, historically, we only had medicine. Like that was it. It was medicine and therapy. But now with the advent of new technologies, there are so many new things that are coming up. I call this the renaissance of mental health and the renaissance of psychiatry, because we are offering treatments now which were unheard of even 5 years ago. So let's start off with the most traditional treatments for anxiety. So with anxiety, there are historically selective serotonin reuptake inhibitors that are called SSRIs. And those are historically things like Prozac, Zoloft, Lexapro, Trintellix, all of these medicines that only increase one chemical neurotransmitter in the brain, and that's called serotonin. Now, these medications are very, very effective in treating anxiety, but they come with some side effects. Some of the major side effects are some people can gain weight on them. Some people can have sexual side effects, which they don't like. Some people feel a sense of like if it's too strong that they're a little numb. So we have to be a little bit careful about the dosing of those, but they're very, very effective. Other medications that we use are things like other categories of antidepressants like Wellbutrin. I love Wellbutrin because there's no weight gain and no sexual side effects. Wellbutrin is effective also as a third-line agent for ADHD, so it helps with attention, concentration, and memory. It's an energizing antidepressant. The only thing about Wellbutrin is you can't mix it with alcohol because you can have seizures. So that's probably one of my favorites. Unless you're an alcoholic, it wouldn't be a good choice for you. Another category of medications are the SNRIs like Cymbalta or Effexor. Those are a little bit more energizing as well, and they're a different category, but these are all medications. They're not addictive. In fact, SSRIs are safer than Tylenol or Advil. If you had a bottle of Tylenol or Advil, you could die of kidney or liver failure. But if you had a whole bottle of SSRIs, your stomach probably hurt, but you'd be safe. So SSRIs are very, very safe. Now, there's another category historically that doctors use, and those are the addictive medicines like Xanax, diazepam, Klonopin, Ativan. I generally don't use those unless the only time I'll ever use an addictive benzodiazepine, which is what Xanax or all these medicines are, is when a patient's having a panic attack. If they're having a severe panic attack, I will give them a few just to kind of get rid of the panic attack itself because it'll calm you down. But my favorite treatment for anxiety, you'll be surprised to know, is actually a blood pressure medicine called propranolol. And I think it's such a wonderful treatment because not only does it lower the anxiety, it also relaxes your blood pressure. So you can have a dual effect. A lot of patients are misdiagnosed with high blood pressure. They don't have high blood pressure. They have anxiety. And because of anxiety, their blood pressure goes up. And the doctor says, oh, your blood pressure's up. And there's even a phenomenon called white coat hypertension for patients with anxiety, where every time they see a white coat, which is like a doctor's coat, their blood pressure goes up. And so I say, let's treat the anxiety, and that automatically lowers your blood pressure. And guess what? The patient doesn't have high blood pressure anymore. But I love propranolol. I use it quite a bit, once or twice a day. It's very safe, very effective, and it's not addictive. My last, one of my favorite ones, well, I've got a couple more. There's an important medicine called Buspar. Buspar is the only medicine on the market today that treats just anxiety. It's not for depression, and you can take it 1 to 3 times a day. It's not addictive. A couple of others are Atarax. Atarax is a medication that actually used for itchy skin. It's little babies use it. It's super safe. It also calms you down, but it kind of makes you a little sleepy. So those are the main ones in terms of medications. Let's talk about therapy. The number one most effective treatment for therapy, is cognitive behavioral therapy. There's a lot of therapy that is occurring right now during the pandemic. And the wonderful thing right now with the advent of telemedicine and telepsychiatry is you can have your therapist in the comfort of your own home. So right now, every single practice that has psychiatrists and psychologists working right now, pretty much all of them or most of them are doing telemedicine, and your insurance company will pay for it. That was the wonderful thing that came out of COVID, is that now insurance companies are paying for video visits. So you can do this out of the comfort of your own home. You don't even have to step out. You don't have to worry about social distancing or anything like that. The last one that I think is really important is exercise. Exercise increases a very special neurotransmitter in the brain called dopamine. And dopamine is the chemical neurotransmitter in your brain that makes you feel happy, that makes you feel relaxed, that makes you feel good. That's why when you see these personal trainers that work out all the time, they're like, hey, I'm a personal trainer, I'm a happy person. And they're always like so pumped. It's because they've got all that dopamine going in their system from exercising. So I always say exercising, drinking 6 bottles of water a day. That's how much we're supposed to drink a day, guys. Yep, 6 bottles. I did not know that. I used to drink like 2 when I was good. No, you need to drink 100 ounces of water a day. Our bodies are 90% water, so you have to drink water, exercise, and sleep. Sleeping is so important. So a lot of times for anxiety, I'll actually give patients medications that are not addictive just to help them sleep, because just getting the sleep in and of itself will make your mental health illness, no matter what it is, during the pandemic or not, it'll make you feel better. What are specific things that are important to keep in mind during this pandemic? Let's keep a schedule. One of the biggest problems I have with everyone in this pandemic is y'all's schedules are all off. You aren't sleeping on time. You aren't waking up on time. The gym's closed. You stopped exercising. You don't have any sort of normal schedule. And that can really throw us off, because human beings do better on schedules than they do when they're just kind of left to their own devices at home. So it's extremely important to make sure to put yourself on a schedule, not take naps in the day. Remember, for every half an hour that you take a nap in the day, it delays your sleep by an hour. So if you take an hour nap in the day, you're not going to go to sleep for 2 hours later, at least. So try not to do that. Practice sleep hygiene. That's what we call that. And make sure to take care of that aspect of your health. Another really important thing is you've got to stay in touch. If you want your anxiety to improve during this pandemic, you got to get on televideo, you got to get on the phone, write letters if you have to. You have to stay connected with the people that you love. Do not isolate yourself and spend tons of time on social media. Another thing that's really important that I tell my patients, do not overdose on the news. It's just not good for you. Watching the news, all the time with all the different media outlets. There's a lot of exaggeration. Make sure you get your news from proper sources. Give yourself a certain allotted time that you're going to watch it. Don't constantly be looking at it all the time. It'll definitely increase your anxiety and worsen whatever mental health condition you're in. So limit and restrict your news watching. Also restrict your screen time. Try to get out in the sun. A lot of my patients are suffering from, especially in the South Asian community, it's very important to know, most of us are vitamin D deficient. I think it's this whole thing about you don't get out in the sun and darken your skin, so we just never get out. So we're all like vitamin D deficient on a good day. But now with the with the pandemic, it's gotten much, much worse. We have tons of patients now whose vitamin D's are levels when I draw them are like almost zero. So I've put my patients on a once a week 50,000 international unit prescription strength vitamin D to help with the energy levels, because when your energy levels are low, your mental health is going to feel even worse. So remember, sleep also is the cornerstone of mental health. You've got to get the right amount of sleep. I'd lastly like to talk about a very important discovery or new technology, new science that's come in the treatment of psychiatry. So psychiatry has traditionally, like I said, always been medication management or therapy, and that's it, and like good healthy diet, exercise habits. Now we have a new treatment. We have new treatments. We just got approval for depression and anxiety to be treated by micronutrient infusion therapy. You may be wondering what that is. So we've got genome-based micronutrient infusion therapy, for example, in my practice at New Horizon Hospital, where you do a cheek swab, you do DNA testing, you find out what's missing in your DNA that's related to the neurotransmitters in your brain, and you IV infuse the body with micronutrients. So normally medicine has been outside in, right? You take a pill and it goes into your body, it makes you feel better. But micronutrient infusion therapy is the opposite. You get IV infused through an IV with ingredients that your cells need to produce the right amounts of neurotransmitters and things that your body needs to feel better. So it's inside out therapy. And this has become extremely popular. It's the latest cutting edge treatment in psychiatry. We use it for addictions. We use it for sleep. We use it for chronic pain. We use it for mental health conditions. And it's been extremely effective as an adjunctive treatment, meaning with the medication and the therapy, we're using the infusions to make you feel better. During this coronavirus pandemic, it's been extremely effective because we've added zinc, vitamin D, and vitamin C, which are extremely important antivirals, into the micronutrient infusion as well. So our patients, especially our frontline workers, people that are essential workers that have to go out, we're adding that into their infusions. We're also adding things like glutathione and NAD, which help with energy for patients, and these are things that are helping with their mental health and well-being. So getting a micronutrient infusion therapy, we usually do it once a week for the first 3 weeks, and then we go into maintenance for once a month. So that's an excellent treatment also for depression and anxiety. Like I said, there's other mental health conditions as well, but today we're mostly talk about anxiety and overall mental health and wellness. The other treatment that we have available now is light therapy. It's called blue light therapy. And these are for people who don't want to take medications. They're just like, nope, I'm not going to go there. Give me another option. So we give you the micronutrients. They're totally natural, have no side effects, and they make you feel better. And then the blue light therapy is a special light, and it's research proven. It's insurance approved. All of these are insurance approved and research proven evidence-based medicine treatments for depression or anxiety. And you lay under the bed and it gives you blue light, and the blue light treatment, and we've always known this for a long time, sun therapy, light therapy is very, very good for mental health. So get out in the sun, and if you're not, then come on in and get some blue light therapy if you're not getting enough and you're just staying at home all the time in your social distancing bubble. And that also helps with mental health and wellness. So once again, the holistic approach is physical health, which is what we've talked about today, emotional health, which is getting therapy, getting the right support internally, having positive thoughts, externally keeping positive people around you that lift you up. Spiritual health, reaching out to your faith-based groups, or even having a purpose. Purpose-driven life is extremely important. The most successful people mental health wise are those that have the strongest sense of purpose, like Seva, the organization that Gidesh is talking about. Having a sense of purpose is extremely important in your mental health and wellness. A lot of people during the pandemic are doing food drives, distributing masks, helping elderly get food, things like that. There's so many things we can do during that time that help with our mental health and help make us feel better in our hearts and in our minds. And then intellectual health. Intellectual health has to do with living your passion and feeling not like a robot, but feeling like that brain is just zapping and moving and feeling like you're on the pulse of your brain. But that all comes when your physical and your emotional and your spiritual health are intact. Now you can reach the stars, the sky. When all those three things are established, you can get that intellectual health super strong and pursue your hopes and dreams. I really hope that this helps all of you to understand some of the things that our patients are facing right now during this pandemic. Like I said, I always tell people whenever there's a crisis, I get busier. And especially with this situation right now, I really hope that all of you educate yourselves, educate your families, and reach out to a mental health professional if you are dealing with any sort of anxiety, depression, or even anger, mood swings, or sleep issue. There is help for you out there. And we are so blessed to live in the United States now where, like I said, telemedicine is now an approved treatment in all fields of medicine, and especially in mental health and wellness. This concludes my talk. I'm open for questions if anyone has any questions about symptoms or treatment options or anything else, really. Thank you.
Thank you, Dr. Rashid. Yeah, we do have questions, so I'm just going to jump right into it. A community member is asking for what the difference between a psychiatrist, psychologist, and a therapist is.
That's an excellent question. I get that all the time. So the difference is that, so I am a psychiatrist. In order for me to be a psychiatrist, it's just another specialty of medicine. So I'm a medical doctor. That means that, for example, if my patients have high blood pressure, I can write a medicine for high blood pressure. I can write a medicine for diabetes. I can deliver a baby. I'm trained to do all of those things. But then after medical school, after I became a medical doctor, I chose to be a brain specialist. So anybody in any field of medicine, whether it's oncology, gastroenterology, immunology, cardiology, they're all different fields. Psychiatry is another field. So we generally do medication management, but we are also trained in therapy. So basically we're team leaders. So under a psychiatrist, you'll have a psychologist, for example, and in psychologists, there's different kinds. It's important for y'all to know there's LPCs, which are licensed professional counselors. Most therapists that do clinical practice of therapy are usually LPCs. That's kind of what you want to look for. That's kind of like the gold standard. But we've also got LCSWs, which are licensed clinical social workers. We've got LMFTs, which are licensed marriage and family therapists. And these are people that go through university and major in psychology and then do a master's degree or a PhD. And then they do 3,000 hours of clinical internship work, but they only do counseling. They cannot prescribe medication. Whereas someone like myself, who's a psychiatrist, can do both. We can prescribe medication and we're also trained to do therapy. Most psychiatrists now, however, only do medication management just because of the sheer need of patients that need medication. Some doctors like myself, I just enjoy therapy. So I have a therapy-based practice and I have some patients that come to me for therapy as well as medication management. So remember, a psychologist is a counselor that does talk therapy. A counselor does talk therapy, but they are not medical doctors. So that's the main difference. I can prescribe medication, but they can't.
Thank you. The next question we have is from Anasuya. So she says that there is sometimes a stigma on going to a psychiatrist or seeking help or a level of denial. How would you start the conversation with someone who may need more professional help?
You know, that is such a huge issue, not just in the American community, but especially in our Asian community. It's so interesting because the majority, I always find it amusing. The majority of patients who get psychiatric care get it from their general doctor. they're more ready to go to a family doctor and say, I have headaches and back pain, but it's actually depression, like chronic depression. And they'll take the medicine from their general family doctor, but they refuse, but going to see a psychiatrist means that you're crazy. But I think that the doors are opening for that. And I think the best way to bring that up is if they really are against seeing a psychiatrist, is really ask them the list of questions. How's your sleep? How's your energy? How's your interest? How's your memory? How's your concentration? Do you have feelings of guilt? Do you not feel like living anymore? Do you not feel like, there's no zest for life? Do you feel like crying all the time? Do you see that these are things that you're struggling with? And more focus on the symptoms and say, maybe there's a doctor, and start off with just a primary care doctor and say, we can go talk to them about it. A lot of my patients come through referrals from a primary care doctor, where a majority of psychiatry is taking care of primary care docs. Like I said, most general docs in this country, most psychiatry is taken care of by general doctors, but the more complicated cases or the more significant cases, they'll refer over to me. So I tend to see patients, the whole gamut. I see patients that just need talk therapy, and I see patients that are very serious. So I would say maybe focus more on the symptoms and talk about maybe there's something we can do to help with that. And also try the other modalities of treatment that I've suggested, like maybe they want to come in for infusions because they're feeling low energy, and that'll be a segue. Or maybe we can do light therapy. I heard you're not getting enough sunlight. It's COVID. You're not stepping out as much. And maybe that'll bring them into the office. And once they get evaluated just for that, maybe that'll segue into whether they need medication as well.
Great, thank you. Honestly, hopefully that answered your question. If you have anything else to ask, please feel free to add on. Generally in the Indian community, I know it's a lot tougher to speak to your parents about mental health issues. So do you have generally any advice on specifically that?
I think, once again, talk about what is affecting. So, for example, in the Asian community, especially our community, performance at work or at school is really, really important. So I think approach it with the things that your parents value. So if you say, I'm just not doing well in school, I don't know what's going on, I need to go see the doctor, or I'm just not able to function well at work, or I'm just not able to sleep despite you giving me, my Ayurvedic, treatments, or asking me to drink a glass of hot milk. I'm trying it, it's not helping. I really want to do better, and really approach it from the standpoint of things that your parents value too. So if they value that, that you go to school, or that you have a good job, or that you help around the house more, or that you enter into, maybe they want you to get married and they're like, why aren't you meeting anyone? And you're just clinically depressed. It's like, hey, if you want me to get married, maybe I need to go get some help for myself. So I think it's really important for parents to also not feel like a failure, because if a kid has a medical issue like asthma, they're all about getting the treatment, but somehow parents also see their children as narcissistic extensions of themselves, and they feel that if their child needs to see a psychiatrist, they failed somehow as a parent. And that's not always the case, because there are and you tell them, you say, you guys, and if they want to push it that way, there's a method of talking. It's called the compliment sandwich. It's where you compliment, then you give the punchline, and then you compliment again. So maybe you say, Dad, Mom, you guys have done such a great job raising me. And then you talk, I love that I can, come to you if I need anything. And this is my issue. You talk about the issue, and then you compliment them again. Say, this has really nothing to do with you guys. You guys are doing everything you can. I'm just dealing with some things that I think are outside the realm of what I want. And I want to meet the goals for myself to be as successful as I can be. And I know that'll make you happy. And I know you guys love me. So using the way we approach our families or anyone, the compliment sandwich is a tried and true method. Whether you're trying to fire an employee or get something from your parents, it works. Compliment, punchline, compliment. I hope that helps.
Thank you. Definitely, thank you. We've got a few questions regarding some techniques and tools that can help during this time. And, some of the things that I personally use are meditation as well as Headspace. So do you have any specific tips that you can
Absolutely.
talk about?
Thank you for coming up with that. I talked about therapy in general, but the most popular form of therapy is cognitive behavioral therapy. And cognitive behavioral therapy is the tried and true best method to treat anxiety. So one of the most simple things that I teach patients in cognitive behavioral therapy is deep breathing exercises. So what you do is you go breathe in, and we can all do it together. 4, hold, 1, 2, 3, 4, and then breathe out. And so you get yourself into a quiet space, put some nice music on, don't have any music. You can do it while you're driving, while you're laying down in bed, while you're sitting around watching TV. Just do deep breathing. I say do it between 30 to 50 times slowly as you're counting. Now, what does that do psychologically? First of all, it makes you focus on the numbers. 1, 2, 3, 4, hold, 2, 3, 4, breathe, 2, 3, 4. Takes you away from that. It's harder to have two thoughts going on at the same time in your mind. So you're focused on the numbers and the breathing instead of the thoughts that are making you anxious. Now, here's something scientific that you guys are all going to learn today. There's a special nerve called the vagus nerve, and it attaches your heart to your brain. And it is triggered, listen to this, it's triggered by deep breathing. And when it's triggered, it sends a message from the brain to the heart, telling the heart to slow down. And then the heart sends a message back to the brain saying, slow down. That's why that old adage would say, hey, relax, take a deep breath. You know where that comes from? It comes from the scientific reason that when you breathe deeply for 30 to 50 times, and you can do that multiple times a day, 3-4 times a day, it actually lowers your blood pressure, lowers your heart rate, and it is a way to even break and help break a panic attack when it's happening. So that's one really tried and true, easy method. And like I said, it's a form of cognitive behavioral therapy. But we also do things like guided imagery, where that's where you work with a therapist though, or you use all 5 of your senses to imagine a space, what it smells like, what it feels like, what it tastes like, what it looks like, and you kind of go to your special place in your mind, what you were talking about, headspace. So these are all, without getting too much more into it, these are some methods, and you can easily find some on the internet as well. But definitely meditating is huge, especially being Indian, of course, we all do yoga. And that's also an excellent form of cognitive behavioral therapy.
Awesome, thank you. And to kind of add on to that, Arun was asking a question in terms of resources, specifically around governmental and non-governmental resources for mental health.
Sure.
Anything you would share?
Like I said, and nowadays there's a lot of wonderful hotlines that have come out just through COVID. In fact, I was researching the other day for a patient on, I just went on Google and looked for free mental health resources. Within the greater Houston area, we have what's called MHMRA. I don't know if anyone's familiar with it here, but it's the government authority for mental health. And for patients that don't have finances, as long as you have like an ID and you're legal, you can go and you can apply. You can, I think the office is on Shepherd and Highway 59. You can go to MHMRA and you can go to the walk-in clinic and you can register and you can get free mental health services by seeing psychiatrists as well as therapists and counselors. So I hope that helps.
Yeah, definitely. Thank you so much. I know that especially right now with individuals kind of losing jobs and being unemployed,
Sure.
It's a little bit difficult to find
MHMRA is the way to
resources.
go. Go get your card and you'll get all your medications and your treatment for pretty much free or very, very low cost.
I'm just going to jump in for a minute, and we will continue with the questions and answers after I've given Dilbag a chance to speak a little about upcoming events. He has to drop off at 7:30 for another appointment, but we will continue. As you had explained, you would make some extra time available. So Dilbag, at this point, I'd like you to speak a little about the upcoming NextGen events, and then you're welcome to leave, and I will continue with the questions for another 5 minutes after you leave. Then we'll come to Gitesh to ask him to talk about the Seva International Group, and I'll propose a vote of thanks. So Dilbag, a couple of minutes about what the NextGen is doing in the near future.
Yeah, thank you so much, Jagdeepji, and thank you so much, Dr. Rashid, for taking time to join us and have this presentation, as well as Dr. Shah. NextGen, few events that we have coming up are the Young Minds panel, where we bring out young professionals in the field of specific fields, whether it's finance, engineering, or anything else, to talk about their fields. And then this gives young professionals the opportunity to engage them and ask questions about those fields that they themselves are going to be going into. We also have a few events around entrepreneurship coming up, whether that's a pitch competition or potentially even something around recruiting. So those are just a few of the events that are coming up. And I do encourage everyone to follow us as well as IACCGH. on Facebook and LinkedIn to keep an update with all of our events. That's where we post everything. And if you have any other questions, just feel free to email me or Jagdeepji or any of our other team members, and we'd be more than happy to help you out with any of those questions. Great. Thank you again, everyone.
Thank you very much on behalf of the Chamber to the NextGen for all the great work you're doing. I will let you drop off whenever you like. I will at this point carry on with 2 or 3 more questions. We have some interesting questions that I want to present. And then once we've done these questions, Gitesh, I will come to you to talk about Seva International before I propose a vote of thanks. But Dilbag, thanks a lot. So I have a question from one of our attendees, Arun Kanka. He said he received it from a community member. And his question is, teens like adults are glued to their screens. Is that an addiction, and is there a solution?
I'm sorry, you muted out the lot. You said teens are prone to what?
Teens and adults are glued to our screens. Is that an addiction, and is there any treatment for that? That's
Well, that's a very interesting and entertaining question, actually. I think all of us are suffering from that. Whenever our phone batteries died, that's when we realize how addicted we are, because we have the heart palpitations and we have the constant reaching for the phone, and we have that increased blood pressure and looking frantically and overpaying at the gas station for a charger. You don't care how much it costs because you need that charger so you can get your phone working again, right? So, you know, I think that we need to separate out the usage of screens for work or for directions on Google Maps versus just playing video games all day or being addicted to social media. I think social media, I've done many talks on social media and the pros and cons of it, and I definitely think that addiction to social media or the internet or just your screen is just as much of an issue as addiction to anything else, because taking it away can cause, and how do you know that you're addicted? When you take it away, you feel nervous, you feel irritable, you constantly have, instead of drug-seeking behavior, you have phone-seeking behavior or screen-seeking behavior, right? You're in a bad mood. You see all these kids, you take their screen away, they're like sulking at the, dinner table, or they act oppositional. They can even get aggressive or violent. I can't tell you the number of psychiatric admissions I've had that involve breaking of cell phones or computers or something, So definitely, I think that the issue of screen addiction is huge. And I think that it's gotten much, much worse with the pandemic because so many parents don't know what to do with these kids all day. How do you entertain them? So stick them in front of a screen so they'll just be quiet, right? So I think it's so important to, if you realize that you're spending hours and hours and hours on the screen and you're not able to get away, and you realize that it's taking you away from the things you need to do, like paying your bills or exercising or taking a shower or going to visit, a relative that you need to, or basically taking you away from the fundamentals of what you need to be doing, then it really becomes an issue. That's how you know also that it's really an addiction, is when you get addicted to something, you'd rather play video games than do your homework, and your grades suffer, et cetera, or your work suffers because you're serial binge watching Dynasty on Netflix, whatever it is, I think it's something that we have to recognize within ourselves. I think as far as teenagers and children, definitely parents, I think it's really important that we all monitor how much screen time our children have and make sure that we implement proper substitutes. It's not fair to not give your kid anything to do and at the same time expect them to not look at their screen, right? So you got to get them out. That means you have to get up and you have to have the time to go bike riding with them, or to go exercise with them, or go swimming with them, or do some regular book reading time with them, So remember that if you're going to take an addiction away, you have to replace it with something else that's healthy. You can't just take it away. That's why you see a lot of people that are like smokers and they'll suck on like lollipops because they still have that oral fixation. You got to replace that addiction. So I encourage parents and adults and teenagers to check and see if it's affecting your ability to do other things, and also to balance your life. Like I said, physical exercise, getting your things done, staying on a schedule, getting outside, getting some sun, and really participating in as many activities as you can right now, despite the fact that you're stuck at home. So I do hope that helps.
Thank you very much. The next question is, this pandemic has affected elder people. What message would you like to convey to senior citizens of our community who are under lockdown for the last 3 months and can't engage socially and might be in a compromising situation of anxiety and depression?
Sure. First of all, my heart goes out to the elderly. My mom and dad are part of that group, and they really have been affected. We used to take my dad out on walks all the time, take him out to the town center, and we stopped doing that. So he's been stuck at home. So first step is get out and get some sun. Sit in your backyard, sit somewhere, get some natural sunlight. Try to take a walk if you can, if you're mobile, or have someone push you in your wheelchair. Get out and get some fresh air. That's the first thing I would say. Second thing is stay in touch. I think it's so important for not just the elderly that are watching this, but for all the youth. You all have parents and grandparents. Reach out to them regularly. Have a regular phone session. It's so easy to forget. So easy to forget that our parents are stuck at home and can't get out. And it may be a few days or even a few weeks or a week that you haven't talked to them. Make sure to set a schedule. Make sure to get your family members to engage with them in group conversations. Help them to set up their phone, internet access so that they have access to that. Use social distancing and wear your mask and gloves. And if you can, see them from a social distance. There was a time when my mom would be at the entrance of the house, and I would be right at the front, 10, 12 feet away. And she would put her chair there and I would put it there outside, but just to be able to see each other. That lack of physical touch, that lack of seeing your loved ones can be extremely, extremely deleterious to an elderly person's mental health. So trying to stay in touch with them, getting them out to exercise, keeping them on a schedule, making sure that they're active, and also make sure that they're eating. Make sure that they're getting the groceries that they need. They may be too shy to ask you that I need some eggs or I ran out because they don't want to be an inconvenience. So ask them every day, what have you run out of? Leave it at their front door. Let them know that you care about them. If they feel not loved, they're just going to get sicker faster with or without COVID. I hope that helps.
Very much. So there are two more questions that I'm going to ask together. These will be the last two questions. We do have some more, but we've run out of time. So these two questions are, what are the top three things that community nonprofits do to prevent anxiety and other disorders in the community? And the other question is, what are a few good resources where we can find details of governmental and non-governmental resources for mental health?
Very good. So the first one was, what can we do to decrease anxiety in the community? Was that the first question?
The top three things that nonprofits can do. For example, if SEVA wanted to help with mental health during the pandemic, what are the top three things you would recommend they do? And this is coming from the SEVA leaders. And the second question from the same SEVA leader is, what are the few good resources that they could go to? You could be one of them.
So let me answer the first question. First part, I'm going to forget it. Okay, so the top three things. First of all, I think things like this, educational seminars, reaching out to the community. Awareness is the first most important thing. There's a lot of shame tied to mental health. A lot of people see it as a weakness, that I'm strong enough, I should be able to get through this. So I think education is number one, so that people know what they have, or if it's something that needs to even be treated. Number two, I think that there are a lot of mental health professionals that are ready to volunteer and reach out and give their time for, especially now that we're doing the video Zoom appointments, that you can ask God knows there's a ton of Indian psychiatrists in Houston saying, hey, can we tack on one patient a day in your practice, or 2 patients a week for charity work, care? And I'm sure that no psychiatrist is going to say no to 1 or 2 extra patients that they do as a service. So I think if organizations like SEVA just did an outreach to all the doctors in the community and say, would you be able to accept even 1 or 2 patients? That's easily a couple of hundred patients that are going to get treated that wouldn't get treated otherwise. So I think reaching out and harnessing the power of the Indian community in the number of mental health professionals that we have that are willing to help. So first is education. Second is providing service with psychiatrists. And third, I think addressing the social issues. When I talk about education is not just for making people aware that they have an illness, but educating people on how to cope with it, I think is important too. So having seminars on anger management, couples therapy, drug addiction, bullying, so many different issues that are coming up. I think that should be part of the psychoeducation part, which is what I wanted to mention initially with education. The second is volunteer work. And the third, I think, is activism, is really getting the community go out there and make people aware that this is a major issue and we need more support. That Texas is the 49th state in terms of mental health support from the government. So the only state that's worse than us is Louisiana. So we need more resources. So I think activism, and really, if we can get this group that we have with so many hundreds of members to really advocate for mental health care and improve mental health care and funding, I think that we could definitely go out and really make an impact. By the way, when I say reach out to doctors, I don't just mean reach out to psychiatrists. I mean reach out to counselors and therapists as well, because there's a ton of them. We have a mental health app group that I have just in Houston, has over 90 members that are therapists that I'm sure they would also be able to help at least one patient. Even if you add those up, that's 90 extra patients getting help for therapy. Okay.
That's a great idea. Thank you very much. And we will rope in Dr. Jignesh Shah in that initiative, because the Indian Doctors Association is a very strong partner.
Yes, and a very strong presence.
Yeah. The last question was, what's a good resource where we can find details of government and non-government resources for mental health?
NIMH, it's the National Institute for Mental Health.
Okay.
So NIMH is a national organization. And it really is, it does all the research, a lot of the research that comes out in terms of treatments and epidemiology and all sorts of stuff regarding mental health. But they're a really good website, the NIMH, to really find out where your local chapters are. Like I said before, MHMRA is our local chapter, governmental chapter, but NIMH is really where you're going to be able to find a lot of resources and groups. And then also, if you go into whatever you're suffering from, anxiety or depression, and you type in support groups, there's a lot of volunteer support groups that are available in church communities and places like Seva, other things like that. And that's another thing that is a really good suggestion for charity organizations, is to maybe have groups where they bring in people that are dealing with anxiety, like get one group therapist and maybe even have once a month kind of group therapy where they can also get help and treatment and support, especially if it's for the elderly, or if especially it's for people in the Asian community where there's taboos, where they can find other people from their own culture and socioeconomic backgrounds that are going through the same thing, with like one therapist volunteering. So those are some things that will help. But the groups I was saying is NIMH and MHMRA.
Thank you very much. So when Jignesh Shah had talked about you and praised you in your absence, our expectations were very high. But I can tell you that you have far exceeded our high expectations.
Oh, thank you. I'm glad.
You're a rock star. And I know that when we share this recording, a lot of people are really going to benefit, because what you talked was in layman's language. I do want to make a disclaimer here to everybody who's listening to the recording once the recording is shared. Any medication you need to get prescribed by your own doctor. Don't self-prescribe any of the medications.
These are just some ones that we use that are popular, but you need to get evaluated by your own physician.
Yes, I do need to make that disclaimer, and we would recommend that they come to you if they don't have their own doctor.
Sure.
I hope they don't need it, but if they do, I can't think of it better than you.
Absolutely.
I also want to mention that one of the problems in the community is our unwillingness to talk about mental health, and not just the Indians, but the Asians in general. In fact, several years ago, I went to a funeral of a very close friend. She was Japanese American, and her son suffered from post-traumatic stress from serving in the army. And he came one day, picked up his rifle, shot his mother, killed her, with his brother hiding in the closet. And it seems that he had this trauma for a long time, but nobody talked about it. And it ended up costing this mother, who was a leader in the irrigation community, her life. So we as Christians need to be a little more open about these issues. And we really appreciate your talk today because a lot of people. But before I come back to thank you formally, I want to ask Gish to talk a little about Seva International. And as I said, we will be sharing the recordings of this event. I will be following up with you to invite you to speak to my Rotary Club because every year we are asked to bring in a prominent speaker to talk to my Rotary Club. And I would like to nominate your name as my speaker for my
Thank
Rotary
you.
Club.
Well,
Gitesh,
thank you.
please. Yeah, Gitesh, please.
We
Gitesh,
can't hear you. Get that. You're on. You're mute. There you are.
I'm unmuting. I just unmuted. Can you hear me now?
yes.
Okay. Dr. Rashid, Jagdeep, Dr. Jignesh Shah of IDA, Next Gen leaders, Dilbag and Anish. Good evening, everybody. I'm Gitesh Desai, President of Seva International, Houston chapter. Thank you so much for this opportunity. At the outset, I would like to thank Dr. Rashid for her eloquent talk on mental health issues. And in our community, there is a great need of attention of what you just mentioned in your talk. It is very educational and very informative. Thank you again for that. Seva International is a Hindu faith-based 501c3 humanitarian nonprofit service organization. Our inspiration comes from Hindu spirituality that teaches us serving humanity is serving divinity. The world is one family and let all be happy. Seva International's mission is to serve humanity in disasters, aid local communities, and promote volunteerism. Seva serves humanity irrespective of race, color, religion, nationality, gender, and sexual orientation. In US, we have 43 chapters in over 22 states. During this pandemic, Seva is serving at the forefront with more than 3,000 volunteers. From Katrina in Louisiana to Superstorm Sandy to firestorms in California and Hurricane Harvey, Irma, and some others in Puerto Rico. So Seva volunteers are serving at forefront all crises that we have been going through. Year after year, these last few years are very challenging for our communities across the country. Seva is providing non-medical support with 10 helplines running 24/7 during this pandemic. We raised more than $1 million for the COVID-19 relief efforts. We distributed 650,000 masks that include N95, KN95 surgical masks all across the country, starting from California on West Coast to New York, New Jersey, Atlanta, Georgia, in Texas, Oklahoma, Florida, everywhere. Recently, Seva was elected by FEMA as one of the nonprofits for distribution of free masks to other nonprofits. Just 2 days ago, we received 158,000 cloth masks from FEMA that we already started distributing actually to about 185 nonprofits that they have registered with us. So it's ongoing. We also have 1,000 plus volunteers that are making homemade masks right now. We distributed more than 65,000 hot meals to first responders and frontline workers. More than 50,000 families are served with free food and groceries at our weekly drive-through events. We have over 75 donors registered on our plasma registry. 30 people registered to receive plasma. 4 people were matched through our registry. We provided our registered donors to other plasma banks and connected patients' family to hospitals that were eligible to treat COVID-19 patients per the Mayo Clinic and Red Cross protocols. We conducted close to 100 webinars in association with more than 200 professionals that include doctors, attorneys, financial, and employment consultants to inform and educate the community. We assisted more than 300 international students for their accommodations, food and groceries, travel and other needs since they were from out of country and their dorms were shut down, they ran out of money and all kinds of issues that they face. In closing, all these Seva services are supported by many community organizations and we are very grateful for their trust and confidence in Seva services. With that, at this point, I will return to you back, Jagdeep. Thank you very much for the opportunity again. And it was a wonderful webinar today.
Thank you very much, Gitesh. As always, it's an honor to partner with the Indian Doctors Association, with Seva International, and this time, as I said, we had the Indian Muslims of Greater Houston partner with us, and they had sent out to a group of 300 young professionals that are part of their organization. And we will be sharing this recording with that group as well. I believe there was some glitch with Zoom connecting to Facebook today. So we will be sending our partner organizations the recording to share on your Facebook. We were trying to feed it live, but because of that glitch that's been ongoing today, we were not able to stream live, but we will be sharing it on our individual Facebook accounts. I do once again want to thank Dr. Jignesh Shah, not only for partnering with us, but for getting us such a brilliant speaker. You praised her and you had raised the bar in my expectations, and she exceeded that expectation. We'd love to have her come back for one or two on this topic. So there are a lot of subtle angles that she brought up in her conversation, which may need some more focused attention depending on her availability. We'll talk to Dr. Shah and maybe come up with a follow-up event, which will be for the broader community, not just the Indo-Americans, but the community at large. Because, for example, if Bhavna, you can pull up the slide for our upcoming event. We have an event on the 25th in which we are partnering with 13 other organizations. So these organizations are working with us at an event where we have the Office of Business Opportunity at the City of Houston that will be talking about how the city can help you recover from the pandemic. And we have this list of organizations on the right-hand side, ranging from AHOA, the Motel Owners Association, Hotel Owners Association, to the Fort Bend Chamber, all the way down to the World Chamber of Commerce. So we can bring in a similar group of organizations and have Dr. Rashid come and talk to that broader cross-section so that a larger cross-section of the community can benefit from your knowledge. On the 25th, Mayor Sylvester Turner will be joining us. Again, for those of you who are still looking for care money, there is money left in the government funding scheme. And you can go to Wallace Bank, for example, who is still accepting applications. On the 30th of the month, we are hosting a webinar addressing the needs of people who were already given the PPP money, the Payment Protection Plan money. Once you receive the money, it will only become a grant if you fulfill the criteria that the government has set up. And the criteria kept changing. So led by Swapan Dhairyavan, who is moderating, we have a panel of CPAs who will be talking about what you need to comply with the PPP to make sure that your loan gets converted to a grant and does not remain a loan, which you would then be forced to repay at the end of 2 years. We have another set of events we are planning for next month, which we will be announcing very soon. I also want to recognize our long-term partners. Bhavna, can you bring up our partners slide? So with the Consul General of India, we partner on a lot of events, and we have a group of community partners ranging from Seva to Thai Houston, India House, ICC, IPAC, the Jamaat Khana, the Greater Houston Retailers Association, Pratham USA, and the Indo-American Charity Foundation, with whom we partner at different events throughout the year. And before I finish my vote of thanks, I want to acknowledge and recognize our media partners who help get the word out to the community. One of them is TV Asia, which normally picks up the recording after the event and sends it to TV Asia headquarters, and they broadcast it. A lot of the local radio programs and other programs help us by sending out e-blasts and letting their members know about programs when they're coming up, or bring on our speakers or our leaders to talk about upcoming programs. So we are very proud of our relationship with our media partners. And once a month, on the fourth Saturday of each month, Open Forum hosts the IACCGH Business Hour, where we showcase one of our members or one of our partner organizations and talk to the community about what the Chamber does. The Chamber is proud of the support of our board and our members, and Tarush Anand, the chairman of our board and president of the chamber, joins me in thanking our partners and especially Dr. Shama Rashid for taking the time away from family to address the needs of the community. We are really grateful to you. We appreciate the hard work of the NextGen. And I really want to thank Bhavna, who 7 days a week is available for the chamber's changing needs. We are proud to be serving the community with these webinars. And with that, I want to thank all of you for being part of this successful COVID series, which each time addresses a different need of the community. Thank you, Dr. Rashid. I will stay in touch with you. I hope I don't need professional help, but I hope I will be able to leverage our relationship to help the community. And again, Dr. Shah, thank you for bringing us such a brilliant speaker. Gitesh, all our participants, we really thank you for making the time late in the evening. Let us know if this time works for you, because the reason we picked this time was we were told that it works better for young professionals. Normally our events are in the afternoon, but with that being said, any comments can be emailed to the address on the last slide. My cell phone number is on the last slide. We will be sharing this with you. With that, thank you very much. Today's event is now at an end. Stay safe, stay healthy, and see you at our next event. Thank you very much.
Thank you, everybody.
Right.